Okay, everybody, welcome to today's town hall. It's my clock says four o'clock, and so I see participants are still sort of coming in. So I'll give another minute or so, and then we'll get going just to make sure as many as possible can get in. And I realize others will be coming on as we proceed. This I think is being recorded, so there'll be the opportunity to view it afterwards, as will others as well. Okay, for the sake of time, we'll go ahead and get going. I just wanted to say thanks to all of you parents and any students who may be with us. We are excited that you've come. We're excited for all kinds of reasons. You know, this is a Go Bucks kind of day, as is every day. This obviously has been a crazy year for everybody. 2020 has had all kinds of markers that I hope never to see again, but we've all grown in all kinds of ways, both character-wise and experience-wise, and we look forward to this coming semester to learn even more. Our focus really all along has been how do we make sure that every student who wants to be part of the Charleston Southern University family can have the kind of education that only CSU can provide, academic excellence in a Christian environment where we integrate faith and learning, leading, and serving, doing that every single day, despite the difficulties, despite the challenges we proceed. And so when the semester was interrupted and we got to the end, we looked at each other and we said, you know, as best we can, we're going to push toward having a safe and effective resumption of on-campus classes as soon as it's safe to do so. So from the very beginning of that time until this, meeting every single day, certainly in the last couple of months, we have a pandemic task force that many of you are familiar with, a bunch of experts I'll talk about here in just a second, but this team of 40 plus people led by Dr. Jackie Fish has focused on two questions. First of all, can we reopen? And secondly, can we do it safely? And I would say I'd add a corollary question to that is how do we stay open? And so this is where we have come. And I would just say to you, I realize that as do we, believe me, there's lots of conflicting information out there medically and health-wise. And so our team of experts, all PhDs in one thing or another, but lots of PhDs in the health sciences, as you'll see, have focused on how do we do this well in our context. The one thing I would say to you as we proceed here is to know that these are challenging questions, but we think we have answers to them to mitigate risk, understand risk, to do things like surveillance and talking to close contacts of those who might get safe, isolation, quarantine, classroom distancing, all of that kind of thing. At the same time, us doing the best that we possibly can. And again, the words safety and effectiveness go together here to make sure that students have the best possible education and as importantly, the best community building experience on campus that we can have, because this is a critical period in the life of our students. And we realize that we're here for them. It's no coincidence that our impact statement is preparing servant leaders to pursue significant lives. Last thing I'll say before I talk about the objectives here is just if you would put yourself, if you're a parent or a student, put yourself in our position just for a second. I know this is going to be a little bit difficult to do, but when you approach a question, you know, you will naturally approach it from the perspective of your family and your student primarily. We don't have the luxury of doing it based on individual context all the time. And so we're focused on how do we do this well, not just for one person, but for 3,500 people who are going to be on our campus, faculty, staff, and most importantly, students. And so that's the driving force here in our decision making. And it is, as always, what's best for students. But we realize that faculty and staff are critical part of the equation. So the slide you see in front of you now talks about objectives. I'm doing welcome introductions now. Then I'll talk about the task force goals really quickly, and I'll introduce to you those who have really led the task force's efforts the last several months. And you see their names there. We'll talk about data. We'll talk about how we are effectively mitigating the risk. And I say mitigating risk because there is going to be risk. There's risk on every campus across the country. You know that. You've been engaged in those conversations. You've seen it in the media. And we are on top of all that as well. And so we'll talk about all that. You'll have a chance to pose any questions that you may have. And as time allows, we'll answer those. And be aware, we're going to have additional town hall meetings all the way through. And the task force's job does not stop the day that classes start. In fact, in many ways, that's when they get going, all right? And so there's going to be constant contact, and you'll have the ability to engage with the task force to answer all the questions that you have. And so thank you, first of all, for your trust in us and for wanting to be part of the CSU family. We're looking forward to having as safe and effective a semester as possible. Next slide, please, Gabby. If you've seen the CSU magazine or if you've seen our Facebook page, and if you haven't, I hope you will, my commentary this month in the magazine is called Prayer of a Pandemician. Pandemician is a word I made up, and it simply refers to anyone who has endured a pandemic. It's a made up word because there is no word for what we've been going through. And so I'd ask you to read the prayer, because what the prayer says is, despite the fact that we have seemingly lost control, the fact is that God has not lost control. And our difficulties are there, they're evident, but He is there with us. And as many of you parents have reminded us along the way, you know, Charleston Southern, because we trust in the Lord, we don't operate by a spirit of fear. We operate by a spirit of faith, and of a sound mind and discipline, because we trust in God. At the same time, we're also not presumptuous on providence. And so we're looking at all the data. When I get in my car, I trust the Lord and I drive home, but I wear a seatbelt every single time. And so I just want you to keep this in mind as we go through this. And so in light of this pandemician, which all of us are now, let me open us in prayer. Father, we thank you for loving us. We thank you for giving us the opportunity to be part of the family of God, to have been adopted as your sons and daughters, to be able to be called sons and daughters of the Most High God. God, we know that we have lots of unanswered questions, but we also know that any questions that we have are not questions to you. You have the answers, and God, we pray that you would give them to us. The scriptures tell us that sometimes we lack wisdom because we don't ask for it. And so we come to you today, as this task force has done all these many months, asking you for wisdom, asking you for discernment, asking that you would, the Spirit of God would empower us to do the things that would give you glory and would be the good for to the good of other people. God, we pray that we would approach this semester, and everyone would, with the idea that we are to love the Lord our God with all our heart, soul, mind, and strength. And equally important, that we love our neighbor as ourselves, and that we would do the things that would be protective of our neighbors, even if they are uncomfortable for us. And so, God, please help us through the massive uncertainty to get to the point where we know you want us to get, and that is having as safe and effective an educational experience as possible this semester and beyond. God, we pray this in Jesus' name, amen. Next slide, you'll see the goals of the task force, and this is it. We charge the task force of these 40 plus people made up of healthcare experts and housing experts and academic experts and athletic experts and facilities experts and cleaning experts and all kinds of experts, to make sure that we have taken this problem, looked at it from every angle, and come up with the best possible solution. We're about to publish a return to campus guide that will answer nearly every question you have. We realize, as much as you do, that having a plan is not the most important thing, but the implementation of that plan, which is going to happen here very soon, most of it's happening already, that will create additional questions about specific challenges that we'll face once students and others get on campus. And so that's why the task force will remain, and our pandemic healthcare coordinator, whom you'll meet in just a second, will be on the job 24/7. God bless her. And so thanks to all of you for being here today. Next slide, please. The task force is led by Dr. Jackie Fish, who wears multiple hats, as does everyone on the task force, but she is, as you know, the Vice President for Academic Affairs. But equally important, she has a career in disaster preparedness and emergency management. She's a nationally known instructor in these issues, travels the country as her schedule allows, teaching these concepts. And so she is leading the team, and we're blessed to have her, being the air traffic controller of this 40+ person task force. Next slide, please. The task force, you'll meet all of these people today as well. Dr. Fish, I've mentioned her. Gabby Poole is kind of Dr. Fish's right-hand person, and I've added she's also her left-hand person and her right foot person. And some of us have experienced the right foot of fellowship from Gabby Poole along the way, and that's been very helpful for us as we take all the data, sometimes conflicting evidence, and put it into something that makes sense for us in our context. Dr. Shipe, you'll hear from him just a little bit later, as you'll see. He has his hand on the pulse of all the data, and we'll talk about that and talk about how, despite what the data may look like at any given time, the risk mitigation protocols that we have in place have been put in place because of our unique context and making sure that we're doing things correctly. Next slide. Here's a picture of Laurel Glover, who is Assistant Professor of Public Health, but she is kind of our full-time infection control and COVID-19 coordinator. Like you, we pray that her tenure will not be needed for more semesters than this one, but she'll be doing the job as long as is necessary until we get to the other side of this pandemic. What I would say before she takes over is that she has theoretical knowledge that will blow your mind, but equally important, she also has very recent practical knowledge. But she did what I would call a civilian deployment to New York City for a good number of weeks. She's recently returned from that gig, in which she served as a respiratory therapist on the front lines of COVID-19 in New York City medical facilities when New York City was at its height. And she volunteered to go do that because that's just who she is. And so that's who we have kind of engaging you, answering your questions, and she'll be there all along the way. And so thanks so much for y'all being here. Next slide, please. Okay, take it away.
All right, well, thank you all, first of all, for joining us this afternoon. Our goal today really is to provide an overview of that return to campus document that Dr. Costin alluded to, and it will fully outline our campus opening plan that we're gonna put into use or put into practice with the fall semester. So the CSU Pandemic Task Force has consulted a number of different resources to create that guide and to create the many policies and procedures that we'll roll out for faculty and for staff and for students. So you see some of those resources listed on this slide as well as on the next. We were also able to consult with other institutes of higher education, both in South Carolina and across the country. And we've really made sure that our policies are in line with what other campuses will also be attempting in the fall. Now, many of the infection control practices that we'll talk about today and that we'll talk about with students throughout the fall semester that really are the most effective ways for us to prevent the spread of COVID-19 rely on self-accountability. So because of that, we're asking all of the members of our CSU community, whether they are employees or students or other stakeholders, to commit to what we're calling the BUCSAFE pledge, which is rooted in Matthew 22:39, love your neighbor as yourself. So all of our members of the CSU family will be asked to take responsibility both for their health and for the health of their community. We'll be asked to commit to wearing a face covering and maintaining safe social distancing, to practice good hygiene, to be understanding, helpful, flexible, and to follow the campus guidelines that we're going to outline today and then again throughout the fall semester. But all of that being said, ultimately, there is no way for us to guarantee that students and faculty and staff are not going to contract this virus while they're on the campus or during the fall semester. So what we are aiming to do is to minimize that risk in the ways that make the most sense for us as a CSU family. So with that, I'm going to turn things over to Director Poole, and she's going to talk about some of the practices that we will implement in the fall.
Well, thank you, Professor Glover. It's an honor to be able to speak to you all today about the work of the Pandemic Task Force and our plans for reopening. And again, just to reiterate what Professor Glover said, there is no way that we can eliminate risk on campus. And as Dr. Shipe will show you in just a few minutes, we do know that that COVID exists in our community. And so it is very important that we do everything we can to mitigate that risk. And so this CSU return to campus plan outlines initially several kind of tenets or the foundation for how we're going to do that. And those include the best practices that you see here on the screen. So everything from screening, physical distancing practices, a face covering policy, hand hygiene recommendations, cleaning and disinfection modifications, and really the most important is a clear approach for sick individuals and positive cases and for their close contacts. And so we're going to talk through a couple of those right now. The first is the screening process. And so one of the things that's going to be most important to us as we continue to reopen the campus this fall is ensuring that people who have symptoms associated with COVID-19, and as you can see here, the list is quite lengthy, but that those individuals, whether they be faculty, staff, or students, are not coming to campus and potentially increasing the risk for exposure to COVID-19 on campus. And so we're going to do that app, a mobile app called BUCSAFE, and we're actually going to be sending out information along with the reopening guide about downloading that app and the resources that CSU is providing on that app, including a daily health check. And every day we're asking that students, faculty, and staff complete the daily health check, which will ask if you have any of the symptoms that are listed on the screen, as well as if you've had any exposure potential for COVID-19. And if you do answer yes to one of those questions, you'll see that it'll direct you with a red X to contact our university coordinator, Professor Glover, for more information about next best practices, which would include not coming to campus or not leaving your dorm room if you're a residential student. If you answer no to all of the questions, then you'll get a green check mark, which you'll be able to display on campus to ensure that you are just reminding yourself on a daily basis what the symptoms of COVID-19 are and what things should prompt you to not come to campus. And again, we'll be sending out more information about this app along the reopening plan. We also are going to employ physical distancing practices across campus. This will include 6 feet of social distancing wherever practical. So in the classrooms, in computer labs, common areas, anywhere that people would gather on campus. We're going to do that by marking off furniture, removing furniture. There's going to be a significant amount of signage on campus with signs like together forward but 6 feet apart to remind everybody that social distancing does make a difference in the spread of COVID-19. We also are going to employ a face covering policy, and face masks will be required in all areas of campus unless you are outside and able to maintain 6 feet of social distance, or if you are working alone in your office or in your dorm room if you're a residential student. As you can see here, several of our current students are modeling the BUCSAFE face covering, which goes over their nose and their mouth. We also have BUCSAFE face coverings that will be available on campus for students as they're returning in the fall. But we will require everybody, including faculty, staff, and students, to wear a face mask at all times. Hand hygiene is obviously a big piece to mitigating the risk of COVID-19. And so we are going to be encouraging our campus community to do just that as much as possible. We're going to be setting up hand sanitizing stations across campus as a reminder of the importance of washing your hands, because we do know that good hand hygiene, in addition to things like social distancing and mask wearing, do reduce the risk of COVID-19 significantly. And Professor Glover, I'll turn it back over to you for this slide.
All right, so our facility staff at CSU has been working really tirelessly to enhance their protocols regarding cleaning and disinfection across the campus. So one of the things that you as students are going to notice is more frequent cleaning of anything that we consider to be a high touch surface area, things like bathroom faucets or doorknobs. And that physical plant has done a really excellent job of furnishing appropriate cleaning supplies, and they'll continue to do that. So we will be fully stocked with everything that we need to keep the campus clean and to respond to cases of the virus in any of our facilities. Residence life and the physical plant have developed protocols along with the task force for closing and cleaning residential spaces should we need to following cases of COVID-19. We also have a very clear approach to sick individuals that we'll put into place on campus. As we transition to the next slide, I'll take you through those. So CSU is going to utilize the data from that daily Live Safe check-in via the app, and that's going to support disease surveillance across the university. So we can use that data to look for things like hotspots. Perhaps we have a particular residence hall where we're seeing multiple cases of COVID-19, maybe in a specific classroom or on an athletic team. So that's where I come in as the COVID-19 coordinator to really manage that process alongside some of my partners on the Pandemic Task Force Public Health and Medical Subcommittee. So we're going to do our best to contain disease on campus by providing really clear instruction to students and faculty and staff who are affected by the virus. So I want to take a moment and just do a little bit of education as we move into sort of the rest of our presentation. Some of the terms that we're going to use, you've probably heard in the media, one of those being close contacts. There's actually a specific definition for a close contact. Someone is a close contact if they've been within 6 feet of you for 15 minutes or longer. And that's regardless of whether or not you are wearing a mask. You're also going to hear us reference isolation and quarantine. Isolation separates sick people who have a contagious disease from people who are not sick. So someone who is in isolation is either demonstrating symptoms of COVID-19 or they have tested positive for COVID-19. And that's different from quarantine because quarantine separates and restricts the movement of people who were exposed to a contagious disease like COVID-19. Essentially with quarantine, we're watching and we're waiting to see if you do become symptomatic. So the CDC has really clear guidelines for how we treat someone who needs to isolate and how we treat someone who's been exposed and needs to quarantine. And CSU intends to implement the CDC's guidance in our approach to sick students on campus. So individuals identified as reporting symptoms of COVID-19 will be asked to isolate. So for students, we do have dedicated isolation housing on campus. Now, if the student is local, they do have the option to isolate at home if they can get there via private transportation. Close contacts of a positive case will need to quarantine. Again, close contact is someone who is within 6 feet of a confirmed case of COVID-19 for 15 minutes or longer. Another part of my job will be reaching out to those close contacts, and I will contact faculty, staff, and students that are considered close contacts of a potential case. So if you haven't been contacted and you're worried that you were exposed to COVID-19, you weren't, because I will reach out to everyone that's identified as a close contact. All students, faculty, staff who have a positive test or again, who have been exposed to a confirmed case, we do expect to follow the CDC guidelines for quarantine or isolation. And we will provide lots of education and instruction if that is the case for your specific student. We're also prepared to support the isolation and quarantine of residential students. All right, Director Poole is going to talk some about academics at this point and some other facets of on-campus life.
Thank you. So as Dr. Costa mentioned earlier in the call, the task force is comprised of members from across campus in all areas. And one of those areas is academics. This subcommittee is comprised of mostly academic deans as well as some faculty in key areas on campus. And together we've worked to really identify the best way to proceed with classes in the fall to allow for in-person instruction for those who are able to attend in person. And so what you see here on the screen is a few of those modifications. So we have made a modification to the academic calendar, which will now begin on August 19th and end on November 24th. This is in an effort to really reduce the risk of exposure for students who may travel home over Thanksgiving and also during a time when we know the flu season will be picking up and the symptoms of the flu and COVID-19 overlap significantly. Our hope that by ending the semester on November 24th, will extend winter break for our students and allow us to return safely back to campus in mid-January to begin the spring semester. We have reconfigured all of our classrooms for 6 feet of social distancing between student desks. You can see in this picture here a group of students sitting 6 feet apart from one another, all wearing face coverings in class. And what we know about that is that if sitting 6 feet apart and wearing a face covering in class, and then a student later that day becomes symptomatic and contacts Professor Glover to let them know that they do have symptoms, she would not necessarily have to consider everyone in that classroom a close contact. And so that's why it's of the utmost importance to us to maintain 6 feet of physical distancing in the classroom, as well as enforce a face covering policy. We also are installing plexiglass barriers for faculty to teach behind across campus. And one of the reasons that we want to do this is to allow faculty who are able to remove their face covering or to teach behind a face shield to do so that students who need to read lips as part of their education can do that as well. We will record classes for all students. And so that's a really important thing to point out. If you are unable to come to campus, if you feel uncomfortable coming to campus because maybe you live with someone who is in a high-risk category for COVID-19, or maybe you are in a high-risk category for COVID-19, you do not have to do that. You can take your classes remotely, or because they will all be recorded. And of course, part of the reason that we wanted to do this was to ensure that if you are not feeling well, you don't feel obligated to come to campus. And for that reason, we have suspended our failure for non-attendance policy for the fall semester. That does not mean that faculty will not take attendance, because they will, but the policy will be suspended to allow students who are sick or are ill to take the time that they need to get better. And we will circle back to a few more academic things, but I'm going to continue through, excuse me, sorry, one second, to athletics. So athletics is a little bit complicated in light of COVID-19, and we just wanted to provide you a few updates on what we know so far. We have had student athletes returning to campus since July 6th to begin their workouts. All student athletes have to have a negative COVID-19 test before they can begin working out. And any student who does test positive for COVID-19 requires additional screening before they can begin their workout process. The Big South has made a decision to begin sports on September 3rd. And right now, the Big South is working with universities and institutions to determine the best way to uphold the recommendations from the NCAA with regards to student athletes and competitions and what those will look like in the fall. And so we don't have clear answers on that yet. Some of that is because it's out of our hands, and we plan to communicate the state of intercollegiate athletics for the fall in the coming weeks. So student housing has been working incredibly hard this summer to make modifications that will allow for residential students who wish to live on campus to do so in the safest way possible. And so we are limiting the number of students to a dorm room to 2 per room, which means there would be no more than 4 people to a suite. And essentially, those people would become a family unit because they would be together in an environment where they would be able to remove their face masks and would not necessarily be maintaining 6 feet of social distancing at all times. So as Professor Glover pointed out earlier, if you are living on campus and you do become ill or symptomatic, you would be moved to isolation, and the 2 or 3 other people in your suite would be quarantined in place together to monitor for symptoms at that point. We are staggering our move-in times across several days and only allowing 2 guests per resident on campus at a time. And that's really just to minimize the number of people who could be in close contact with one another, and just to allow for better traffic flows. And so if you are planning to live on campus, you are getting emails from Residence Life asking you to sign up for times with some specific instructions about how to do that. Once the semester begins, we will not be allowing guests in dorm rooms or in residence halls in general. And we are requiring a negative COVID-19 test or a positive antibody test for all residential students. And this has to be completed within 14 days of their move-in day. We do apologize for the confusion that was created through an email that went out on last Friday. We hoped to clarify that in our email on Monday. And we just want to even further clarify that it is a requirement. And while it is not a perfect solution, our hope is that by requiring this test, we will catch some people who may be asymptomatic and have COVID-19 before they move into the dorm and potentially expose their roommate and their suite mates, who would then have to be quarantined. And so we understand and we recognize it is not a perfect solution, but we do feel strongly that this kind of targeted testing of residential students helps ensure our ability to open the campus and keep it open, as Dr. Costin stated, because that is really one of our goals. We want to bring you to campus and we want to keep you on campus. Just a few things that are changing in response to COVID-19. Laundry is going to be done on a schedule within residence halls to ensure that we're limiting the number of people in the laundry room at any given time. And every student will have the ability to do laundry at least twice a week if they want to. There will be community meetings with RAs every month to ensure that you have good access to your resident assistant. These meetings will be conducted virtually, and your RA will be getting in touch with you once you've signed up for housing to give you more information about those meetings. In addition, we'll be doing monthly health and wellness inspections in the dorm rooms, just to make sure we're able to maintain the level of cleaning that we need to within those spaces. We're going to encourage residents to disinfect high-touch surfaces in their room at least twice a day, or really before and after each use. We also are encouraging students to really think through what they would need in the event that they did have to isolate, because of course, if you became symptomatic, we'd want to move you into an isolation room as quickly as possible. Once you're in that space, we will provide you with some basic things like a thermometer and a pulse oximeter to use to monitor your health. And Professor Glover will be in touch with you on a regular basis to help ensure your safety. And things like food and all of that will be taken care of and delivered right to your door. Move-in times will be shorter, and we won't be bringing in volunteers from the community during move-ins. And so you really might want to think through what you're bringing to campus and just bring what's essential. And then once you get here, think through if you need to go to the store and bring other, purchase other additional items for your rooms. So student life will look different. And that's, all of these things that we are talking through today are surely making you think this is not going to be the same that it was before. And it certainly will not be. Just like Dr. Costin mentioned, 2020 has been anything but normal for all of us that are living through this together. But we are committed. Your student life team, your dean of students, is committed to still making this a meaningful experience for you in the fall. It will not be the same. More things will be virtual, events will be smaller, but we are going to do our best to create a meaningful experience in the healthiest way possible. So things like chapel will be held virtually in the fall, and you'll still be able to get your chapel credits that way. more information on that to follow. Student life activities are being adjusted to minimize large gatherings. We have postponed several of our Sweet 16 calendar events to the spring, including the Anthony Evans concert, the Harbor Cruise, and Strike Night, just because it's not safe to have that large of an event at this time. The Brewer Center will reopen, but there will be things in place to ensure that that's a safe place for people to work out. And we will be modifying our campus rec and intramural sports activities for the fall. All right, Professor Glover.
So one of the recommendations that the pandemic task force made is that in order to safely bring students back to campus, these students really had to have access to high quality healthcare services. So we are really excited to announce that we have partnered with Federal Healthcare Network, which is a federally qualified health center, and they provide a full range of healthcare services. They have more than 20 locations in Berkeley, Charleston, Colleton, and Dorchester counties that our students and faculty and staff will be able to take advantage of. And in addition to those locations, Federal will actually be on campus at least one day per week. So we're very excited to announce that partnership as we prepare for fall. And at this point in our presentation, I am going to turn things over to Dr. Michael Scheib, and he is going to share a wealth of information and statistics related to COVID-19 data and trends. This information has informed and continues to influence the task force's decision making.
Good afternoon, and thank you for your time. So I was charged with looking at the COVID trends locally, nationally, and worldwide, as well as the best practices that other countries have employed in order to contain the virus. When we're looking at what we're dealing with now, most of us have not dealt with a pandemic. And these pictures simply displays a young man, of course, in 1918, when the influenza had taken place and over 675,000 Americans had passed. Now, during that time, that virus also had a couple of waves of spread. Now, during the first wave was during the World War I, and wearing a mask was considered patriotic. After the second wave came back, the World War had ended, and there were anti-mask leagues. There were plenty of individuals that were unwilling to wear a mask at that time. There were fines that were involved, and in kind, there were people who simply weren't going to wear a mask anymore. So that is always going to be a struggle. We're never going to have adherence, you realize, in public health to 100% the best practices. But I know I'm asked by students now, and I will be each day, why do you wear a mask? So the reason that we wear a mask this time, it is one of the best risk mitigation strategies we have. It is not alone the only thing we need to do, but it's one of the best things we can do to help reduce the risk of viral transmission when it comes to COVID-19. But I wear a mask for a couple of different reasons. One, I am humbled by this virus. As you may have read research, 25 to 40% of the people do not demonstrate symptoms for this virus. So if we were to look at a allegory for that, it is literally the wolf in sheep's clothing. I do not know when I walk into a room, I can see plenty of people, and I cannot tell if a person has COVID-19 in many cases because people are asymptomatic. I also wear a mask not because it's not only humbling, but it's also out of respect. The way that this virus works and the doorknob into your body is something referred to as an ACE2 receptor. Now, it's just better to think of it as a doorknob. It's the way that the virus can get into your cells, replicate, and spread throughout your body. Well, the ACE2 is expressed in your nose. It is expressed in your lungs. And once it's in your lungs, the virus can enter the bloodstream. And then ACE2 is also expressed throughout your cardiovascular system. So it can spread almost anywhere. I have respect for a virus that has the capability to spread to any part of my body in a quick fashion. And then the third reason is I wear a mask because of the health of our economy and the health of our college. If we are willing to do the things that we need to in terms of our personal choices, hygiene, social distancing, and mask wearing, we can enjoy most of the aspects that we do on a regular basis. It doesn't involve a minor inconvenience of wearing a mask, but we can still do many of the things we would otherwise be able to do and keep this virus in check if we can simply practice those principles. And next slide, Ms. Bull. One of the things that you're concerned about is what are the best tools to really corral this virus. The two best things that stand at this time are rapid testing. So we need to do more tests. We need to have a quicker turnaround time because that identifies the individuals that need to be isolated, and thus we can help contain the spread more readily. Secondly, it's contact tracing. These both have been employed in many other countries to great success. And as stated, this can help you keep at bay about 80% of the spread of the virus. But there is no one thing that will do it. There is a compilation of things we must do in order to contain it. Next slide. And when you're looking at success, what we see here is Germany. Now, you've probably read many articles about Germany and their resumption of school. What you see here is a curve which is exponential in nature. So when I think of exponential, 2 becomes 4, becomes 8, becomes 16, 32, and so forth. What Germany has done and what many other countries have done, in fact, over 100 of them, they have been able to corral the virus. They've been able to induce exponential decay. So 32 becomes 16, becomes 8, 4, 2, and then 1. And speaking of 1, when you look at the number of deaths that Germany has reported the last 3 days, it's only been 1. Now, their population is not the same as America. It's a roughly 83 million, which is about a fourth of what we have. Well, yesterday, we reported over 1,460 deaths in America. We had over or close to 60,000 cases. And you can see where Germany now resides, much lower, less than 1,000 cases. So what makes Germany so exceptional? It's certainly not a different genetic profile. They are certainly, just like most people, very similar to us. Instead, they employ a lot of the same things that we are trying to do on campus. 1, they practice prevention. They screen for high-risk individuals. They make certain that people are wearing masks. They have adequate PPE, and they certainly extol good hygiene. They were one of the first countries to really work towards detection. They helped develop some of the first tests. They test much more than we do, which helps us identify and isolate the virus. They contain, they are involved in contact tracing. And although we don't have what would be considered an official contact tracer on campus, Ms. Glover is working along with the BUCSAFE app to help people to not only screen people, but help to make certain who they could have possibly come in contact with to help contain it. And then, of course, the last part is treating. Now, we can detect more with, of course, having Federal on campus, but Ms. Glover has the experience and will have the ability to direct our faculty, staff, and students when they are experiencing problems, when they need to seek additional health care. And keep in mind, these are practices that have been employed at literally hundreds of countries across the world, and they have been effective. So we're going to choose to follow that same model in hopes that we can be effective as well. Next slide, please. So one of the keys, just to reiterate, is the number of tests. When you look at countries that have been successful, now New Zealand is renowned because they have eradicated COVID-19. There's not one case. Now I understand that's an isolated island, but they don't have one case. But they are still assiduously testing. There are a series of countries that test at a very high rate given the number of cases they have. So New Zealand's roughly 377. You can see Germany's 37 to 38. In the United States, we are only conducting about 12 tests for every positive case we have. So we continually will have to do testing if we wish to keep this virus contained. Next slide, please. So, Now, looking at the national averages, you can see, once again, this is the exponential nature of the virus. The cases to the hospitalization to the deaths follow a roughly 21 to 28 day timeline. So when cases start to arise, there's a period of infection, and then when the symptoms will present, when they will become worse and require hospitalization, and then unfortunately we will suffer fatalities as well. Now, you noted, of course, that we had in June, after the lockdown period, we had seen a very significant decrease in cases. Those cases have now doubled in time. And I realized that people that there's a common narrative that, well, we do more tests, thus you'll have more positive cases. Well, we're going to look at that. That's called positivity. That is not the case. There are certainly more people with the virus, but you can see that it also presents a challenge for hospitals. You can see the exponential nature as the increase of hospitalizations has gone up, and now that is presenting itself in deaths as well. So when you see daily cases start to spike, it's going to be roughly a month period before we will know the full effect in terms of the outcomes it will have in terms of the fatalities from the virus. Next slide, please. Another thing to keep in mind is that when COVID-19 originally was identified and we looked at the number of people who were infected and suffered fatalities, that young adults by far and away have a very low fatality rate, which is certainly going to be the majority of our students on campus. But simply looking at the COVID-19 as a positive case, asymptomatic, and when it progresses to complications is not the exact way that you want to look at it. There's nuances in that people will have symptoms, they will not have to be hospitalized, but yet they will have what's called chronicity or long-term effects. So even in the younger population, I know it's hard to see in the print at the bottom, 18 to 34-year-olds, about 20% of them still experience long-term symptoms or chronicity for 14 to 21 days after being diagnosed with COVID-19. This can be general malaise, this could be headaches, it could be trouble breathing. So we are certainly trying to avoid anyone getting the virus, because even if it's the case we're not hospitalized, there are still long-term effects that we need to consider. And certainly this gets higher as we get older with our faculty and staff, but even young people certainly do experience some significant issues when they contract the virus. Next slide, please. So the South by far and away is leading the positivity rate, and positivity rate is the number of positive cases divided by the number of cases. So it's a ratio. If you test 10 people and one person is positive, your positivity is 10. If you test 100 people and there are 10 positive cases, once again, your positivity is still 10. So it's not the number of testing, it's still the number of positive tests that arise that this is tracking. So you can see that the South has the highest positivity rate. It also makes up about 60% of the overall cases throughout the country. Next slide, please. So it's not surprising to see, if you go to the next slide, Ms. Poole, that you also will see in the South, they have 61% of the hospitalizations. So that's showing us that where you see the highest number of cases in kind, you should see the highest number of hospitalizations as well. Next slide, please, Ms. Poole. And finally, this shows up, the South also represents roughly 56 to 60% of the fatalities as well. So that is consistent. And you're like, well, that's consistently bad information. I understand that, but this is a novel virus and we need to look for consistent variables so we understand more about it, we understand more how to treat it effectively, and of course, understand more about how to prevent its transmission more effectively. Next slide, Ms. Poole. So locally, South Carolina looks very much like the South. It has seen an exponential rise in cases, which started, as you can see, after the first week of June. The current hospitalizations are still at a peak. We're hoping that they plateau because, as you can see, the cases have started a downward trend, but it takes 7 to 10 days to see that in hospitalizations. And thus, we will still see an increase in fatalities likely for the next 4 to 7 days. And then hopefully those two will level off as well as the course of the virus is completed. Next slide as well. And to give you an idea of South Carolina, their positivity rate, which is listed in the fourth column, it has hovered around 18% for the last 2 weeks. So it's starting to see at least a slight decrease to 14 and 16%. But you have to consider that South Carolina has been one of the, had the highest rates of positivity in the South. And so you wouldn't be surprised to see that we have seen an increase in hospitalizations and deaths, but those two should start curtailing given that the case number and the positivity rate still remain on a downward trajectory. And then the last slide, Ms. Poole. So to give you an idea, one of the reasons that we're trying to prevent of course, the transmission of the virus is to keep people healthy, but also when a significant number of people contract the virus, they require an immense amount of care. And there is a very high rate of these individuals that are admitted to the ICU. And if you're not familiar with the intensive care unit and its practices, typically an ICU runs at a fairly low occupation rate. It's not until it gets to around 80% that it's considered to be constrained. So you can see here in a couple of the different states where it's in red, you see constrained in Georgia and Nevada and Alabama. Fortunately, South Carolina is on the border of that, and hopefully, like as I mentioned, the cases won't increase that much. But that's one of the things we have to keep a very keen eye on that data, because we want to make sure that the ICU is not overtaxed in the instance that these individuals need additional care and also ventilators. So when we are practicing the principles that we're championing, whether it's social distancing, whether it's good hygiene or face mask, it's not only helping our health, it's helping others, and it's also helping the hospital being able to contend with this virus more effectively.
All right, so Dr. Scheib did a great job of kind of summarizing what's happening at the state level, at the national, even internationally. And another task that our task force has taken on is monitoring the situation in our local hospital system. So what you see on this particular slide is the number of inpatients. This was current as of yesterday morning. These are all inpatients that have been admitted to the hospital for COVID-19 or complications from COVID-19. So part of what you'll see in that campus reopening guide is that the task force will continue to monitor the situation in area hospitals just to ensure that the healthcare system is capable really of responding to emergencies should they arise on campus. At this point in time, I think we're going to go ahead and hopefully transition to a couple of questions that y'all have submitted in the Q&A section.
Yes, thank you, Professor Glover and Dr. Scheib. And, you know, we wanted to present the data today just to help you all understand that the data in South Carolina is informing the work that we're doing. We're very aware of it, we're following it closely, and we're using it to help make decisions about whether or not it's safe to bring students back to campus. And so we don't say that to scare you, we say it to help you understand that we do recognize it, and we feel confident at this point that the safety practices that we are putting into place will allow us to bring students back to campus safely if we're all willing to be committed to the BUCSAFE campaign, the BUCSAFE pledge, and hold each other accountable to really making these best practices our new normal on campus, at least for the fall semester. And so there are some questions that we are getting, and we'll take a few minutes to answer those. I do want to let you know that if you did complete the student survey a couple weeks ago, those questions have helped inform our reopen guide, as well as this presentation today. We will take those questions as well as the questions we get today and ensure that they get answered in our frequently asked questions section of our webpage that you can find by going to our main webpage and clicking on the red banner at the top of the page. We will be updating that shortly and getting a lot of questions answered for you. So please, if we don't get to every question today, please bear with us. We're listening to them, and we do want to do a good job of making you feel comfortable that we are able to answer your questions. So just a few things, and Professor Glover, I'm going to give this one to you, but can you talk a little bit about what dining will look like this semester?
Yeah, absolutely. So we have had to make some changes so that we can socially distance. So we will have a lot more grab and go options for you in terms of dining. Java City will be a new place that you can swipe your card to get a to-go meal. And then we're adding some additional dining spaces outside where you can be socially distant, but you can sit and enjoy your meal. So the dining hall will be open. It's just gonna look different physically in terms of setup, and it's gonna have a reduced capacity as well. We're also looking into hopefully some mobile ordering options, but there will definitely be more information about that as the semester draws closer. No more buffet style. I think that was a question in the Q&A. There won't be any self-serve stations. However, we have been assured that if you want 2 to-go plates, because you're used to being able to go back and get seconds, you're gonna get 2 to-go plates so that you can eat your fill.
All right, another question is that came up is about, will tutoring still be available? And that's a great question, just about student services in general. We are encouraging as much that we can to happen virtually, just to eliminate risks for in-person activities when we can. But those services will continue and will be readily available to students throughout the semester. And you'll get more information about what each of those will look like in the coming days as well. I also saw a question about lab courses will those be online? Well, they won't be online, they will be recorded. And so if you are unable to participate in a lab course in person, you will have the ability to participate from your own home. We do encourage students, those are harder classes to do online, and those are classes that we would like to do in person as much as it is safe to do so. So if you're able to attend in person, we encourage that. If not, we encourage you to work closely with your faculty and course instructor to make sure that you are able to meet the learning objectives of that course. There is a question on here about athletics, and Professor Glover, I might send that one to you as well, just about, can practices start as soon as we get back? Can you talk about maybe just a little bit of the changes that are for student athletes?
So one of the great things as far as athletes go is that y'all have an athletic training team that is following a pretty strict protocol for you and takes a lot of the guesswork out of how we need to approach the plan for athletics. So your individual coach will have a plan for you based upon what sport you are playing, what are your living arrangements, and whom you're going to be exercising with. So will you start practices? Yes. Will it look like it has every year prior? No, not necessarily. But if your coach hasn't already been in contact with you, I imagine that they will be soon to talk to you about, for your specific sport, what it's going to look like when you get back to campus.
All right, I'm going to try and maybe address 2 or 3 more questions just really quickly. And again, these are not, if you do not get your question answered today, please bear with us. We will address it, but we want to be sensitive to time. So there's a question about the library. The library will be open once we reopen campus in the fall, but every space on campus will have reduced occupancy. And there will be a sign on almost every single door telling you how many people can be in a given space at any time. And the social distancing practices will be in place for places like the library as well. There's also a question about Better Healthcare and that partnership, and will it look the same as the Trident Family Health Partnership? It will be different, and we will be providing much greater information about what that looks like on our website in the coming days. But we feel very confident that it is much more comprehensive and will afford students, faculty, and staff better opportunities for healthcare if they need it. Okay, I'm gonna try and do one more. Let's see if I can get one more. There will be a way, this is an easy one. There will be a way to rewatch the town hall. This has been recorded and it will be shared for anyone who's been unable to attend today. And we plan to continue to do these on a regular basis. So please stay tuned, check your Buck mail on a regular basis so that you can get information about this, as well as the reopening or the return to campus guide as it becomes available early next week. And so with that, Dr. Costin, I'd love to turn it over to you just for final remarks.
If I could have a point of privilege here, there's a question here that I think would be good for Laurel to address. What should I do if I know that I regularly experience headaches but have confirmed them to be from another cause? And so I think this would apply to others as well. Who have a typical reaction. It's how they live their lives. They've gotten used to it. So Laura, would you just address that in light of COVID-19 and their surveillance aspect, et cetera?
One of the tricky things about COVID, it's a nasty little virus. And one of the problems with it is that many of the most common symptoms are things that we can very easily attribute to something else that we encounter in our everyday life. So we want you to be completely transparent when you are doing your daily symptom check. If you have a headache, I want you to tell me you have a headache, even if you regularly get them. That being said, I'm going to follow up with you if you flag where you get that big red X that says don't come to campus. And if you have allergies that you deal with on a regular basis, we'll talk about it. And we'll determine at that point in time what is the appropriate next step for you. But it really is very important that you be completely honest when you're doing that symptom check. This is sort of the first line of defense in terms of protecting us as a CSU community. So if we get into a situation where we're thinking, oh, it's a running nose is not that big a deal, or a headache is not that big a deal, it might not be, but it also could be potentially a big deal. And we really want to minimize the impact, both for you and for everybody else around you. So be honest when you fill that out, and I'll follow up with you, and we'll kind of flesh out exactly what the right next step is.
Thanks, Laurel. And I think that's a good way for us to transition out. Honesty is going to be what we're all about. We're going to be honest with you, and we want you to be honest with us. And you can trust that all of us are going to be making the best possible decisions for the safety of everyone on campus, so that we can have the most effective educational community building experience possible in the middle of a pandemic. And so what we are all hoping and praying for is that this would be a one-time good deal. You know, there may be some spillover into the spring, but we hope certainly by then that much of that will be mitigated. And despite the data, despite the fact that, you know, COVID-19 is roaring across the nation, and South Carolina is no exception to that rule, we are confident, based on how we have processed all the data, how we continue to process it, the processes that we have in place, that we are taking every reasonable precaution in our context to make sure that people are as safe as possible. And again, I'll just go back to, we take this very seriously, because we're dealing with you. You're part of our family. We love you as if you're part of our family, and we hope that that's mutual. We do greatly appreciate the feedback that we're getting from parents and students. We ask you to continue that, because we're going to need the implementation of the plan is going to you know, it's going to be crawl, walk, run. And we think we have a good plan, but there'll be some modifications that we make as necessary, as with any plan. And so God bless all of you. We look forward to seeing you on campus and hearing from you. And there'll be other opportunities to do these kinds of engagements, so that we can make sure we have the best possible campus experience here in just a few weeks now. And so God bless you. I look forward to seeing you very soon.